I didn't want to go out, see anybody. I was consumed by fear of every little thing, fear of having like every little symptoms. I was always thinking it was something deadly, and I was examining my body. If I was having like a little spot, I was already thinking I was having a skin cancer. I really had no life. I was miserable.
This channel is about patients sharing their stories in healing. Oftentimes, people are frustrated with not having the right answers when it comes to their health. I created this channel to share patient stories with you. Maybe you'll resonate with someone, maybe you will learn the path that they took to healing, and it helps you in your own journey. Welcome to another episode of Healing Journeys. We are here today with Cristina, who is going to talk to us about her journey through anxiety. A lot of you may relate to that problem. Oftentimes gets dismissed by the medical community or just has one solution, a prescription, and no other tools to help you identify the symptoms or help you with the tools to navigate anxiety. So welcome today, Cristina, and thank you for sharing your story.
Thank you so much for having me, and I'm so happy to be here and share my story. I know that having the opportunity to listen the journey of other people is an incredible tool that can help anybody to feel less alone and help to go navigate it toward the recovery. Like you say, I had a severe anxiety and panic attack starting. I probably had it all my life, but I had this like crazy journey a couple of years ago when I luckily find you, and my life was miserable. I couldn't even say I had a life. So I was consumed by fear of every little things, fear of having like every little symptoms. I was always thinking it was something deadly, and I was examining my body. If I was having like a little spot, I was already thinking I was having a skin cancer or like I really had no life. I didn't want to go out, see anybody. I was um, I was miserable. So
Yeah, thank
I'm much better now.
Yeah, well, I'm so glad that you're much better. But I know that, the symptoms that you're describing, a lot of people can relate to that. They feel overwhelmed. It affects their daily living. Their thoughts are invasive, persistent, and pervasive. They repeat the same thoughts over and over again, even though their health anxiety can cause them to have severe impairment when they have to deal with other people. There's also some amount of anger because no one else is helping them, or they feel hopeless and helpless because they don't have answers.
Mhm.
And not being able to sleep, not being able to eat, not being able to function can also be a problem. So Christina, tell us a little bit about 2 years ago when you started to have these spells. What was your day like?
Well, like I started having this, and I'm sure it's related also with the fact that I probably had some hormonal imbalance, and so I was experiencing some of the typical menopausal or premenopausal symptoms. And of course, having a health anxiety, I wasn't dismissing or I wasn't thinking, oh my God, it's going to go away. So every little symptoms could be like just a simple headache or insomnia or like having a palpitation. I was over and over and thinking, oh my gosh, what is this? Why is not going away? I wasn't even thinking about my hormones, but actually it was a true anxiety. So I was constantly having this palpitation, and I couldn't breathe. And those symptoms were mostly the time turning into a panic attack. Panic attack that they were completely debilitating. Like for 5 or 6 hours, I was shaking because I was keep thinking. I was trying everything to try to stop it, and the more I was trying, the more the panic attack was getting worse. So I've been seeing some doctor, and like you said before, many times I was dismissed with, oh, it's just anxiety, just take some Xanax or just take this medication. And they were not really helping. I was even anxious to take the medication because I was trying to be healthy. So just the idea of being dependent on the medication was give me anxiety. And it wasn't really helping because I was still having the same symptoms. All those symptoms and the anxiety it really affected my lifestyle. Like you say before, I was afraid to be in a social scenery because I was ashamed, and I was feeling like, oh, what if I'm having a panic attack, or what if I die? What if nobody can or disrupt the whole social situation? Like it could be a dinner or a restaurant. I've been in many time at a restaurant and just sit down, and suddenly my mind start thinking, what am I having a panic attack? And I had to leave. Instantly I was having a panic attack. So I arrived at the point that I didn't go anywhere. I was recruited. I was like having totally agoraphobia. I didn't want to get out of my room. I couldn't do anything.
You're speaking to a lot of the people out there that have very similar symptoms. It leads to social isolation, not being able to get out of your bedroom or even your bed,
Yeah.
and feeling the fear of even interacting with other people or leaving can cause us to then become reclusive, isolated, and then the shame and the guilt of it to feel like you can't be outside and anytime this could come upon you, and not having control over your symptoms, not knowing when it's going to erupt or when it's going to affect you, can really be disruptive. I do want to bring you back to the point you made before. A lot of times people get dismissed when they have panic attacks and anxiety, and it gets just blamed, especially women, that this is just part of your
Yeah.
mental state. But it's so important to talk about hormones, Christina, because a lot of women that are in their 30s, 40s, 50s, 60s, or even on the extremes of age may be having hormonal imbalances. And that could be the root cause or one of the root causes of the hypervigilance and hyperarousal we call anxiety. And it
Mhm.
does get dismissed. So one of the things you and I did together is
Yeah.
that we did a full hormone analysis. We did a full hormone blood panel to look at your female male hormones, to, to look at cortisol, to look at thyroid, and a lot of times patients don't have access to doctors that do those kinds of extensive tests. So I do invite people that are watching today to find a good integrated functional doctor that can do that proper testing. And then
Totally.
yeah, right? Wasn't that an important piece of
Oh,
revelation?
absolutely, absolutely. Because even when I first recognized that it could be, as you recall, like the hormone, I went to see a doctor, and I was treated like not as a, as a person with like the problem the specific levels having, but with general, like they were giving me like hormones like a general population, and it was creating more problem because I was tired, and then they were giving me more testosterone, and so I had even more of those palpitation, which caused me to have anxiety. So I was going to the opposite, instead of going toward recovery, I was going to the opposite direction. I was feeding even more my anxieties. It was terrible.
So important to bring up that point that it's not just low hormones that can cause symptoms. Even excessive over medication with hormones can cause the problem. And I see that a lot, that patients will go to these clinics that are hormone clinics where they're just pounding the
Yeah.
testosterone and pounding the estrogen, and they're doing pellet therapies and they're exaggerating the dosages, and they're not quite doing lab tests to follow up if what they're prescribing is in good range. So another really important point for folks that are getting hormone replacement therapy, make sure that your clinic, your doctor, your providers are doing routine lab tests to see if you're over medicated, because that's just as important as not getting enough. So thank you
Yeah.
so much for bringing that point up.
Absolutely. And I actually have to say that the traditional medicine, sometimes just follow, the whatever the panel. And I think as a functional doctor like you, it's so important to actually communicate it with the patient because we are all different. And sometimes, like you have to listen to your body and, dismiss what really is like the average. It's like how you feel. As you recall, many times, I was having other symptoms and I had to lower my estrogen, even if the normal range was supposed to be like that. But I felt so much better, with like a lower estrogen. And it was like always different, every 2 or 3 months it was different. So it's really important because, like you say, it's important to have a dialogue with the patient, understanding the lifestyle, what they're eating, because the hormones can come from it, not just from your ovaries, or you can produce estrogen even based on your lifestyle or like your weight, or so it's so important. And then I never had that That's why I was having all this problem, because the traditional doctor says, okay, your range is supposed to be here and here. Here's more. Here's more. And I wasn't feeling good. I wasn't. And they were saying, well, they're normal. They're okay. So stay on that.
Mhm. It's so important for any age group. If women are listening to us today and they're in their 20s and 30s,
Yeah.
oftentimes if they're menstruating, they get dismissed or they're just given a standard birth control pill. They're not given any other option, or they never get tested. They say you're too young to be tested, and that's also not true.
Mm-hmm.
There are a lot of women who have early menstrual irregularities, polycystic ovarian syndrome. They have high estrogen states. For them, taking too much estrogen can actually cause more anxiety and psychosis and panic attacks and stress. So knowing each person is individual and testing each age group. And then on the other extreme of things, Cristina, oftentimes if a woman is postmenopausal, their doctor might dismiss them and say, you're too old to take hormones, or it doesn't seem to make a difference. And unfortunately, that's misinformation.
Mm-hmm.
Now we're reevaluating the studies that were done 20 years ago, and we're debunking the story that women don't need hormones. We're also debunking this theory that it causes harm. In fact, the right amount of hormone at the right amount of time can actually save lives when it
Mm-hmm.
comes to cardiovascular health and even breast cancer. So it's so good that we're talking about hormones, because oftentimes this subject gets tabooed
Mm-hmm.
because there's misinformation about the importance of replacing hormones in women.
Yeah.
So tell me, when we decided to do the hormone replacement therapy, what were some of the changes you noticed in your mood, in your behavior, and in your daily life?
I slept better, and I was suffering of this crazy migraine. I have migraine and headache, and I was like basically traveling with the ice pack. Because I was always afraid, like, oh my gosh, I have a headache. And it was debilitating. So when I find the right, amount of hormones and the right, hormonal therapy, my headache, you know, they were just like really mild. And most of the time, they were actually a consequence of a lifestyle. It wasn't even a hormone. Maybe I was drinking a little too much, or maybe I wasn't sleeping enough, but just like something that it was related with lifestyle. And versus before, I was having an impeccable lifestyle, like I'm eating clean, not drinking, not socializing, having the right amount. And I was always like, and that's generate anxiety, because I was saying like, I am so perfect, I'm having the perfect lifestyle, I'm eating right, I'm taking the proper vitamin, and I don't feel good. So to go back to the initial discussion, like it's really important, that you have the right amount of hormones, because everything else function, in a right, it goes in the right place.
And you're right, it's so many different thumbtacks. Sometimes
Yeah.
you're standing on 10 different thumbtacks. And if you're just focused on the one thumbtack, taking anxiety medication, but you're not fixing your diet, you're not cutting out the
Yeah.
alcohol, you're not keeping a proper sleep schedule, you're not addressing hormonal imbalances, it can really not work.
Yeah.
And so it's important to address the lifestyle too. And you brought up alcohol. I do want to bring that up because that's also something that's come in the news lately, that even moderate amounts of alcohol use has now been shown to be dangerous for health.
Mm-hmm.
And we're really encouraging men and women to reduce their intake of alcohol to less than 2 drinks a week. And I know that seems shocking for a lot of people, but just I invite anybody who is suffering from sleep problems or anxiety or mood or depression to do a dry month just as an experiment to see if it is one of the factors that might be triggering some of your symptoms like headaches and
Yeah.
sleep problems and anxiety. So thank you for bringing
Absolutely.
up lifestyle.
Absolutely, even especially anxiety. Even if sometimes I have like I'm not a big drinker, but especially now with the holidays, and have like maybe a couple glasses of wine, I recognize that I actually can see even my level of anxiety when I wake up in the morning, and I don't have any reason to be anxious, and it's not like the typical hangover anxiety. It's just an overall anxiety of like, oh, I'm gonna go through the day, and I'm not even feeling bad. It's just like a mental level. So I absolutely agree that alcohol has some, negative effect on people with anxiety, for sure, for sure.
And there are other substances like caffeine that can do that,
Yeah.
chocolate can do that, sugar can do that, and even certain processed foods can cause hypervigilance in the system
Yeah.
and lead to inflammation. And that low level of inflammation in the body can cause the body to feel more anxious, not because there's something bad happening in your life, but there's something bad happening in the body. And
Hmm.
that high level of inflammation may be enough for the body to be triggered into this fight or flight syndrome.
Yeah.
That goes for sleep problems as well. Not getting a good night's sleep can lead you the next day to feeling more anxious, more triggered, more irritable, more tired. So your lifestyle, our lifestyles, how we eat, what we eat can be a
Yeah.
trigger. Was there any other foods or any other dietary changes that you felt like made a difference when it came to your symptoms?
Yes, so I actually, for a long period of time, when I was having this episode and I was like right in the middle of my anxiety, I completely eliminated all the caffeine. So no coffee. I did like I substitute with some mushroom coffee or barley, and then no alcohol. I still had a little bit of a chocolate because, they say it's antioxidants. So and the spicy, this I love spicy food. I mean, I'm from Italy, so I like everything that is spicy and heavy. So I try to eliminate those like red peppers or even some of the vegetable like tomatoes, or they were a little bit hard on my stomach. And so I was trying to eliminate everything that was causing or like triggered my health anxiety. So it was having stomach ache, and I find it extremely beneficial. I was like love the sweet potato. So sweet potato were like just like comfort and kind of a comfort food, but at the same time healthy. So that was my
Go
to
to.
go food. Yes,
Mhm.
absolutely, absolutely.
So I do want to stop and talk about that because it's really important to know that every person watching is unique and different in terms of what's going to be good for them. So it's really important to work with a practitioner that can help you identify trigger foods, eliminate those foods, or at least test the elimination through an
Yeah.
elimination diet. And some of the foods that you mentioned, like the tomatoes, can be nightshades, can be inflammatory for some people. There is a whole group of high histamine foods. There are foods that have high histamines in them, and they can be triggers for insomnia and agitation and anxiety. So
Mhm.
sometimes for patients that come in with no reason for their anxiety, I will look at their gut health, will look at the foods that they're eating, and maybe even try taking out some of those foods or have the patient test some of those foods to see if they're making the symptoms better or worse. So another piece of the puzzle can be that you're eating or drinking substances that are causing your body to have that hypervigilance. So
Yeah.
that's a really important point too. Were there any supplements that you found helped you in terms of any of your symptoms?
I will not pinpoint one particular supplement. I think that it was mostly a general change on a lifestyle, and especially I will say way of thinking. That was what really make the biggest difference, even more than taking medication. As you remember, I was like, I don't want to take anything. I don't want to take anything, and I will never forget it. That you have this magical way of saying, look, just consider this medication as a training wheels. So we're just taking it because we are at the point where, like we cannot do different, and it's true. I was really against it, and I said like, okay, I may have to, and that it was great because that gave me that peace of mind to work in other areas, and so I was like a more calm, and I couldn't focus on, develop better way of thinking and practice all the other things that we did together. So
And that's important too, that we're not saying that you don't use conventional methods to
yeah,
treat anxiety. We use the conventional methods while we're working on the underlying root cause of the anxiety. And also for you to start learning more about what's your triggers and what
yeah.
tools you can build in your toolkit. So one of the things you said, Christina, is that you learned how to change your perspective on things. What was your perspective before? And then how did you change your perspective on what's happening?
Well, one of the things that I learned from you is, and I remember every time that I was coming on my monthly session, like every time I was having this episode, it was always like a all or nothing. I was like, I was dying, and that's it, like there was no solution. And then I learned from you that start thinking that everything is temporary. So one thing's come, and the way come, like will go. And I did, for me it was something completely new because it's like, no, this is never gonna be better. but you like slowly, taught me like everything in life comes and go, I like good time, bad time. So that was give me some hope and feeling like, okay. And I learned slowly to surround it, to surround the big crisis and accept it. And I'm telling you, it wasn't easy. It took a long time. So anxiety, unfortunately, you can never fix it, but you can, as we discussed many times, you can learn the tool that help you to accept it and then navigate it, go with the flow. I still doing it. I don't have any more those acute panic attack, but I learned through your course, mindfulness course that you did. I learned how to observe. I learned to meditate, to count until 10 before, I react, and even how to use my word. The word that I use toward myself, how I communicate with other people so I don't create triggers that maybe get anger. And those are the absolutely the best tools that I learned to manage my anxiety. Like I say, I still have episode, and I recognize it, and I am now capable to step back, like if I'm watching a movie, and step back and then looking at myself and then looking at what's going on, what happened, and thinking, okay, I mean, I did it before, so I can go through that, and maybe I just relax and meditate, and mostly, I practice gratitude. Practicing gratitude really, really helped me to stay in the present moment and be grateful for what I have, even anxiety sometimes, compared to people that, maybe they're suffering or they're terminal ill. So I'm thinking, okay, I'm alive, I'm having this anxiety, and I'm grateful because every time I learn something more and then one more tools to, get better to the next one. So
I feel so proud. You did that so well. You have so many great tools that you've talked about. I'm just going to repeat a few of them so the audience kind of gets the premise if they're trying to gain these tools themselves. The first thing is, again, recognizing that everything is impermanent. So even though in the moment, whether it's health anxiety or anxiety in general, it feels like it's going to last forever, knowing that there's a start, a middle, and an end to every experience. So that's a big deal because it gives you hope that you're not stuck in
yeah,
this space forever.
right.
Second is to create a little bit of space because when we go into fight or flight, we come from a space of reactivity. And when you take that count of 10, what you're doing is you're creating space between the trigger and your response. And as you create space, you have choices you can make. So if you just go right into autopilot and you respond to somebody in a reactive way, you're only going to choose the tools that you already had from when you were a kid. But when you pause and take 10 deep breaths or 5 deep breaths or even one deep breath, it gives you enough time to have better perspective. And I love that you pull away like you're watching a movie and you stop, you take 5 deep breaths, you observe what just happened, how you feel, why you feel it, what you need, and what you normally do when you're triggered and what you need to do differently. And then you proceed with kindness for yourself because you have anxiety and this is difficult, but you have other resources and other ways of being. So it's a good thing to create pause. And then using all the tools in your tool belt, breath work,
Mhm.
movement, walk away, find a different way of communicating, like you said. All those kinds of things can come into play, but only when you take a pause and step away and step back from the situation. So I just love that you said that, Christina, because it's so important for people watching to know that these tools do work
Mhm.
and you just have to be more mindful and pay attention to the signs. What are some of the signs that you have now recognized that you're about to get triggered by something? Are you more body aware?
Yes, I'm definitely more body aware, like all the physical symptoms. And so that happen, not very often, but sometimes they happen, the palpitation, and I use the same tool. So first of all, it says, okay, the way that, it could be, instead of thinking I'm having an heart attack, I'm thinking, okay, maybe it's I'm a little bit tired. Maybe my body, my hormones are a little out of balance today, or so I'm capable to be more rational and thinking, okay, I'm not gonna die. So definitely I'm more aware of my body, and I'm capable to use these tools. And it's not easy, because when you are in the middle of anxiety, it's easy to say, but it's not easy because it requires an incredible amount of courage. And I remember like how difficult it was, even the most simple things. And I'm talking about just going from my bed to brush my teeth. I didn't want to, like, I spent so many months in bed because I was treating my anxiety as a illness. So I was like, and it was worse because I wasn't obviously not tired. I was in bed and I keep thinking, why I have it, what is gonna be, maybe I'm gonna die, and it was days and days and days in bed, and then until I find the strength and it's equal. I mean, climb the Mount Everest, even just to get out of bed because you feel dizzy, you feel nauseous, you have this palpitation, even just going to brush your teeth. And I start slowly, and then I find that courage and to go against my body to say, stay here, like just like not move. And then slowly I learned that I could do it. I could brush my teeth. And it take a long time, maybe a month. And then I said, like, okay, now I'm going to the sofa, And like I say, it sounds easy, but it's absolutely incredibly, you require a lot of courage. But I promise you that if you're starting with, you know, just these little things and doing a little routine, and even if you're sick, even if you're like nauseous, just break it through. Slowly you get better. Your brain recognizes that there is no threat. You can do it, and then every time you do a little bit, a little bit, a little bit. So, and I know it's difficult, but it's possible. So that's important. It's difficult but possible. So
You're giving people hope. Your courage and your strength and your ability to overcome something so difficult will give people hope that they too, if they're listening and they suffer from the same things, they're unable to get out of bed, brush their teeth, get up to the couch. They know that it's possible. And just you sharing that with them is going to give them the courage
yeah.
to want to try it.
And it's such a tight community because it's only who really suffer anxiety understand how difficult it is, because we use the word anxiety too often. And I remember talking to some of my girlfriends, says, "Oh, come out, with us." Like, I can. And then I say, like, I'm having anxiety. Oh, me too. Lately I've been so anxious. Well, there is a difference between being anxious because you have a lot of things on your schedule and having an anxiety disorder. An anxiety disorder is mental awareness, and it's different to be recognized by people that don't really suffer. And also the people that have it, you feel kind of like in your own, like sometimes in a box, because people don't understand your pain. And then when you're saying, even your loved one, if they never try, they don't understand. They may say, come on, go out and take a walk or a fresh air, and like you can keep saying, like, I can't. And so you feel like even worse because you feel like in your little world, and you feel like really emarginated. You feel like, I never gonna get better. I'm never gonna get better, because you feel so alone and so fragile, because you really like recognize, I can't even go to the bathroom. And then you're trying to tell the people that live with you or your friends, you don't understand, I can't do it. And then, they may think you're crazy. And it's not a good feeling,
No.
because you don't want to say, I'm anxious, because you keep saying it, and then it's just like, it's awful. But unfortunately, it's work. It's a lot of work. It's possible. It's not easy, but it's possible. And let me tell you, I was in a bad spot, and now I have a regular life. So I do everything, and even like last year, I have a hip replacement. And I remember talking to you, and you were giving me all this tool. Like, how you feeling? Like, I was like, I have no fear. I'm ready to go. So. That's a
That's a
lot.
big deal. That's a
Yeah,
big deal. And
absolutely.
so, for the folks that are watching us today, Christina, anything that you want to share with them with, the journey is not a straight line. It's obviously
Yeah.
all over the place, but
Yeah.
what would you tell them that they could do today that might help them move the needle towards better health?
Well, definitely the lifestyle. Try to as simple as your nutrition and your like supplement. If you can, especially now is the holiday, so the holidays triggers a lot of anxiety, even for people that don't not necessarily have anxiety disorder. So try to eliminate all the extra work that you think you need to do it. I keep saying, even to my own daughter, it's okay to just not doing anything. Just be with yourself, be more playful, and not always feel that we have to, especially as women, we have to do everything right. We have to take care of everybody. We need to do everything right. So it's okay just not doing anything. So take time for yourself, and also I learned through my anxiety how to really love myself more. I'm definitely a caregiver, so I always encourage her. And I remember talking to you, and sometimes you were saying, like, you always have such a nice things to say to everybody, uplifting everybody. Why you don't love yourself in the same way? So, and it's very difficult to recognize that, but that's what we do. So I start there. And one more time, find the courage to doing that little uncomfortable things, the thing that you don't want to do it. Just find the courage to just do a little, because this is how you learn that there is no fear. The fear is the fear of the fear, like they say. It's true. I was fearful that the fear was coming. So, and the only way to eliminate that, which is to me it was the most debilitating thing, is like have the courage to do that little thing that scare you, and see that there's nothing to be scared, and do it again. So this is my advice.
It's beautiful. Thank you so much. I want to thank you again for coming today and sharing
Absolutely.
your story. And I want to thank everybody here for joining us today. And I'll see you next week for another episode on Healing Journeys.